Alright guys, just a quick video on how to pack a wound after you do a abscess drainage, after you squeeze all the pus out and try to get as much out as you can. You're gonna have this little pocket of opening left in there. So what you're gonna do, you're gonna have all your gloves, all your technique of standard precautions going on. You're gonna get your normal saline. If you have like a needleless syringe or like an IV catheter that you can guide in here, because you really want to irrigate this and flush out as much stuff as you can. If you can just get this in here and just like flush like as much as you can and just get all the debris out, that'll help it a lot more and contain no bacteria in there. So you really want to irrigate it. You don't want to just flush it like just like that on top and think it's done. You really want to get in there and just like clean everything out by flushing and irrigating it really well, and really get all pretty much everything that's the abscess or drainage or all the bacteria that's stuck in there, and that will really get it out. So you just kind of want to just dry it in there. Either way, you're gonna pack it so you don't have to make it completely dry or anything. So you're gonna get your packing strips. You're just gonna depend how much room you want on the length of this. After you soak it with normal saline, depending what the order is, it could be Dakin solution. You can either use a Q-tip to guide it in, or you can use little forceps to get in there. It just depends what your preference is, and you're just gonna slowly just push it in and just glide it in there one by one. So you just take it and just keep going slowly. And main thing is try and get every area of the abscess that was drained packed, because our main goal is to heal the inside and get everything cleaned inside, because you don't want pockets healing and then basically have more pressure injuries or sores that come out of there, plus you get more bacteria buildup. So basically you just work your way in. It's just 1, 2, 3. Just take this and just push in, and push in, and I'll just do all the work from there. You don't have to really force it in. You'll know when you don't have enough room, when there you can't really push any more in. Let me just have to leave. Main goal is here. You always want to leave that tip. Yeah, see that's where it's a learning mistake right there. So as you saw how I messed up there, so main goal is to keep the tip that's out, because if it goes all the way in, it dries up and you're really gonna have a hard time getting in there. So you're gonna have to just leave like at least something hanging out, so when you come to the next dressing change, you can easily pull it out, guide it out. But if you're gonna need more packing in there, that's why you try not to cut your packing strips. Just try to glide as much and then cut it, so you don't have to worry about 2 strips being packed. So you just keep going and going until you get everything pretty much packed in there, and just leave all that out there. That's the best way to do it. So when you come in next dressing change, it'll just be easy to pull out and you'll know where it's at, so you're not going in there digging with forceps or with your hands or something. Other than that, you're just gonna pack a dry dressing on there, cover it, and then just hopefully not much drainage goes out, and then when you come next dressing change, it'll just be easy to pull out. And you just grab everything and just start over from there, and hopefully it's just healing from the inside out from there. But yeah, that's how you pretty much pack it. It's the simplest way you can do it, but main important thing is irrigating the inside and cleaning everything out, and then just having the packing in there. But that's the main goal from there. But comment, like, subscribe, let me know what you guys think. Peace.